It's been 15 minutes. I've been sitting here waiting for you to fill out a form and now you want to ask me about my hobbies? Can we not?
Here, what noise do potatoes make?
Hey, how's it going? Welcome to the channel. My name is Cassandra and this is where I talk about my life experiences and lessons learned to try and help other people who might be in similar situations. So if that sounds interesting to you, go ahead and subscribe if you haven't already. This video is a vlog about my journey, let's say, of having an adult tongue tie, and what I've just found out is also having a lip tie. I forgot to make a video before. Earlier today then I went for my first consultation about my tongue tie. Where I'm based, there's hardly anyone who actually does it, so there's only actually two options that I have for people that I can go with. One who does it via scissors and another who does it via laser. So I went for the consultation today for the first time with the person that does it with scissors. And he was, asking me about the circumstances and stuff like that, and explains about the jaw surgery and everything. And he was asking me also before the examination if I think I need the procedure on just the tongue or also on the lip. And I said the tongue for sure. The lip, I'm not sure, maybe it seems okay. And I said, I would really just trust your expertise on that. He said, okay, good. And then he did an examination. It was really funny, I had my tongue pointed up, and at some point he said, okay, and now try and touch your palate with your tongue. And I was like, I'm already trying, this is as far as it goes. He was like, oh, okay. And then he said that, yeah, the tissue on the lip as well also comes down quite far, and that he would recommend doing the procedure, the freedom release, both on the tongue and on the top lip. And actually, since I've come home, and I have been looking into that because I hadn't even really considered the lip, to be honest. I thought it was fine. But actually seeing pictures of how it's supposed to be, I'm like, yeah, actually I should get that done as well, because if you have watched my video about the reasons why I'm getting jaw surgery, you'll know as well that my top teeth are very slanted forward. So they should go almost straight down, but they slant really forward. So actually, once I have the braces and they're pulled back, because the tissue is basically already touching my teeth, the tissue will also be pulled back as I get the braces. So that's probably the only reason why right now it doesn't necessarily seem tight to me when I pull on the lip, but actually it is tight and it will become tighter. So that's actually really good that he pointed that out, and then that I was able to think that through a bit more. So yeah, I definitely want to have both done. I'm still not sure yet though whether to have it done with scissors or with a laser, because obviously the doctors, depending on which one they use, they always say that one is better. So I'm not sure. As I say, I only have two providers to choose from. So yeah, obviously the skill and expertise is a factor, but it's slim pickings anyway, so I don't have a lot to go off. And both of them, of course, say that they do it frequently. What are they going to say now? We never do it, but come trust us anyway, you know what I mean? So I still need to decide on that. And I'm honestly just feeling quite overwhelmed with everything, just booking in all the appointments, and I have to go to speech therapy. And, as of recording, I got my wisdom teeth removed a week ago. Once everything gets approved by the health insurance, I'll need braces and I need speech therapy and everything like that. And I work full time. I'm just trying to organise everything with the appointments and stuff like that. Sorry, the lighting's turned really bad. The sun moved. It's just a lot. It's a lot. I mean, of course I knew there would be a lot already, and I talk about that all the time in terms of the ADHD and stuff like that, and how that process was a lot too. But yeah, it's very overwhelming. It's a lot to handle. It's very stressful, and then I'm trying to organise stuff with work as well. And I know that health is more important than work, but I'm going to so many appointments, and I'm going to be going to so many appointments, so just my personality type, I can't help but feel bad about that. But yeah, I just have to get over it, I guess. So yeah, I need to decide then what I want to do, if I want to go with the scissors or the laser. We already booked an appointment with the guy I saw earlier today to do it next week, next Wednesday, and the appointment for the consultation and the actual procedure with the laser is the following week. They said they can just do it there and then, if they agree that it needs to be done. And I tried to book the appointment with the scissors for the same day so that I would have like 2 weeks to decide which I want to go with. And then, it's on the same day anyway, so I don't need to figure that out with work. But they said no, because of like the holidays the following week and stuff like that, it would have to be next week. And then the following week is when they would take the stitches out. So actually I still have 2 appointments with both practices on the same day, but one would be to actually get the procedure with laser and the other would be to have the stitches removed if I go with the scissors. So then I'm like more pushed for time, I guess, to decide what to do and to try and organise that with work and stuff. Today's Tuesday. I have my first appointment with the speech therapist on Thursday, so I will also ask them and see what they think. And then on Friday I'm having my stitches removed for the wisdom teeth. Yeah, a lot going on, and I really feel overwhelmed. But yeah, it's progress, like this is going to be a very long journey. It's going to be very involved. There's going to be a lot of stuff to do. So yes, it's overwhelming, but no, I don't want to slow down, because spacing this stuff out and not doing them right now will only delay my journey as a whole and mean that I have all of these other health problems and pains and stuff like that for longer. So it seems like a bit of a sacrifice, like physical health versus mental health, but the physical health being bad doesn't help your mental health either, you know what I mean? So yeah, I'm just going to push through, do what I can to manage things. And yeah, I'll check in with you later to let you know what the speech therapist said and how that goes, and ultimately how I choose to get the procedure done.
Hello. So I had my first appointment with the speech therapist today. It was awful. It was terrible. I'm so disappointed. So I'm based in Germany. My German is okay, but I never do medical stuff in German because sometimes I don't even know what it means in English. So that is one thing, there's a language barrier, but that wasn't even the main issue. So I went and saw the speech therapist. The first appointment is an hour, and then the subsequent 9 that have been prescribed are 45 minutes. She spent literally 15 minutes just filling out forms. And she wasn't even asking me questions and then filling them out during that 15 minutes. She did for the next 5 minutes after that. But for 15 minutes, she was just filling out forms. And I was like sitting there waiting for it to be done. Really felt like she could have done that another time. So that was not good. Then she started asking about my hobbies. And I said, is that relevant to the speech therapy? And she was like, no, I just like to get to know people. And I'm like, theoretically, yes, that's fine. We're human beings. You want to know people on a human level, that's fine. But it's been 15 minutes. I've been sitting here waiting for you to fill out a form, and now you want to ask me about my hobbies? Can we not? And I just told her, I was like, look, I understand you're trying to be nice, but I'm here for speech therapy. So can we just concentrate on that, please? And she was like, yeah, I just like to know what, my patients are up to and blah, blah, blah. I'm like, look, this is one of the biggest things going on in my life right now. So this is where all my focus is. I don't have hobbies, I have this, okay? Like, obviously I said it in a nicer way, but I was already feeling like really irritable at that point, but I was trying to mask it because, I know that she's just trying to be nice or whatever, but that's not what I'm paying for, And then she finally was done with the paperwork. And everything she said was so confusing. It didn't make sense. She spent most of the time talking about how she normally does the therapy with children, not actually explaining how she does it with adults, just talking about children. Then she started telling me how often I should do a particular exercise. And I was like, wait, but you haven't told me what the exercise is yet, right? Like, am I just confused, or have you not actually explained it? She was like, no. I'm like, okay, well, can you tell me what the exercise is before you start telling me how often I should do it? She was like, yeah, sure. And she told me that she basically uses the same workbook for everyone. So seems like she's not going to actually do an assessment for me or tailor the therapy to me. Like, the only thing she had me do was take 2 mouthfuls of water, and that was it. She said that later on she'll have me chew on a piece of toast, but right now all she wanted me to do was drink 2 cups of water, and then that anyway she's going to make me do stuff in this workbook that she uses with everyone anyway. And then so when I said, like, can you actually tell me what this exercise is, she then pointed to this one picture that did not in any way explain what it was. Then she was like describing things. She said, oh, it's kind of like this, it's kind of like that. And I was like, look, I don't know what you're talking about. I'm so confused. And she kept pointing to the picture, and I was like, look, the picture isn't helping me. If I wanted to look at a picture, I could have Googled that myself. I'm here in front of you right now. Why don't you just show me? Don't point to a picture. Don't try and explain it with words. Show me what you were talking about. And like I was asking her, like she didn't even say anything about the spot, right? Everyone talks about the spot. So I said this to her, I've heard about the spot. I don't know where it is. Can you show me? And then again, she was just explaining it, and she was like feeling it in her own mouth, like, oh, it's kind of like this, it's kind of like that. And I'm like, do you have like a stick or something that you can just directly show me in my mouth? Just show me in my mouth. And she was like, oh yeah, we can do that too. And I'm like, why did you not do that before? Why did you not do that the first time? So frustrating, so annoying, so disappointing. But the way that it works, like, I got a prescription of 10 sessions from my orthodontist, and the way that it works is that, like, that's your 10 sessions, so you give it to that practice, and that's you. You're committed now. So obviously I didn't know it was going to be like this until the first session, but I now can't switch. One, because for these 10 sessions I need to stick with her, and also I already phoned like 15 places and no one else had appointments. Some of them put me on a waiting list, but no one would tell me how long that was for, just an estimate. And one place even told me that their wait list is closed, and the reason why places don't tell you roughly how long their wait list is because it might not even be this year that you get an appointment. It's the start of May. So I don't have options. If you know about my journey with ADHD and getting a psychiatrist, it's very similar to that in terms of like there's barely anyone who does it in the first place, and then they aren't accepting patients. So I'm super frustrated. Let's see. I mean, as I say, like, she was nice. There is a language barrier. I'm sure she was trying her best. So I'm just going to try and stick with it. I'm going to try and be as patient as I possibly can and just encourage her as much as possible to cut down to the chase and just show me things on my body, you know, rather than like in a picture book, and just see how it goes, because I don't really have any other options right now. Thankfully, when I got this appointment, I didn't take myself off the other wait lists. So if I finish these 10 sessions and it's and I need more, then hopefully if I can get another prescription, then hopefully I can already be closer to availability somewhere else. I asked her also as well for her opinion about my tongue tie, because when I saw the consultant, the dentist the other day, who would theoretically do it with scissors, I completely forgot to ask him, like, is it anterior, posterior, what grade is it, or class, whatever. So I asked her if she could assess me and tell me about that, and also if she could give me her opinion about scissors versus laser and whether I need the therapy also before. She didn't have a clue. She didn't have a clue. You could tell that she was making it up as she went along. Like, she didn't even assess me for the tongue tie. I asked her to, and she said that she would do it, but she didn't. As I say, she got me to take 2 mouthfuls of water. And regarding the scissors versus laser, she was just like, and she was like, yeah, I would go with laser. And when I asked her why, she couldn't explain. Again, I think she just like picked one. And when I asked if I should do therapy first, she said that it wasn't really relevant for her, and just to ask whoever's doing the procedure. So I was like, hell. I've only known about this for a couple of weeks, and so I've only been researching it for a couple of weeks. But I know that speech therapists and myofunctional therapists and everything, I know that most of them have a very strong opinion on this. And she's like, oh yeah, it's not really for me to say, like, hell. So yeah, when I came out of that appointment, and even when I was in that appointment, I was so annoyed, I was so disappointed. It's been a couple of hours, and you know, laughter is a defense mechanism or a coping mechanism. So now I'm laughing about it, but you know, all roads lead to crying. I'll cry about it eventually, but right now I'm just channeling my anger into maniacal laughter. So let's see, I'm going back to the surgeon tomorrow who took out my wisdom teeth, because as of recording, today is Thursday and I got my wisdom teeth removed a week ago on Tuesday. So today is day 10, and tomorrow I'll have the stitches removed. So I'll also ask them tomorrow their opinion on whether I should go for the scissors or the laser. Again, I know it's more about the skill, but I literally only have these two providers to choose from and they only do one or the other. No one else does it here, so don't come for me, okay? As far as I could tell on their website, I don't think this surgeon does it. I didn't see anywhere on their website, and the last time I was there I forgot to ask. But I will ask for their opinion anyway, and then I will make up my mind and decide whether to do the stitches or the laser. Right now, I'm actually really leaning towards scissors, because when they use scissors, they also do stitches, but when they do laser, they don't. And I'm really worried about reattachment, especially if this speech therapist is terrible and if she's not going to give me proper exercises. I think the risk of reattachment will be greater. Also, in a tongue tie group that I'm in on Facebook, I did a poll and asked people what they would recommend. And it's really interesting. The vast majority of voters voted for laser, but the only people who commented said to go for scissors. So based on what I've seen and researched and whatever myself, I have the suspicion that people assume that laser is better, but it might not actually be. Like, it might have benefits, it might be more technologically advanced, but the people who either have had it done by scissors or have had both for whatever reason, people seem to have a much stronger opinion to be more for using scissors. So it's like more people say, yeah, do laser, but for the people that are strongly for one or the other, that seems to be scissors. So that's what I'm leaning towards now, to be honest. But let's see what the surgeon says tomorrow. Oh yeah, the one thing that I am now, after asking that question in the group and getting some comments back, what I am a bit worried about now is that, like, someone had said, you know, is it anterior or posterior tie? And I was like, I don't know. I forgot to ask the guy as well. And I think it can also be both. And I'm not entirely sure what the difference is between anterior and posterior. I've tried to look it up online, but it seems to be either that, like, they class the anterior as the super obvious ones where it's like literally from the very, very tip, and they say that the posterior one is just anything that is a little further back from the tip. Whereas when I've watched surgery videos, it seems to me that it's not about that at all, and it's actually about like how deep it goes back into the tongue tissues and muscles and stuff like that, which you can't necessarily just see. So I'm wondering then whether whoever it is that does the procedure, whether it's by scissors or lasers, whether they'll know how to handle a posterior tie correctly, whether they'll go deep enough, wide enough, and things like that. But again, I only have these people to choose from. Even if I asked them, of course, they would tell me that they can do it. So I think either way, it's a gamble. I'm not going to know. And it's almost like more money, more problems, more information, more worries. You know what I mean? So either way, I'm going to just need to trust someone that they can do it. From the procedures that I've watched online, and maybe it's just because of what's available and what I happen to click on, but I got the feeling that when it's done with scissors, that they go in deeper, and when it's done by laser, it seems to be a lot more superficial. Again, maybe it's just because of what's available and what I happen to click on, but that's my feeling. And again, the reattachment is my biggest concern. Yeah, that's all for now. I will see you soon, I guess.